It's Friday morning. It is the About Mansfield Consumer Advice Series. And today we're talking about your health and wellness because chances are pretty good. I mention this every time we have Dr. Joe on the line here. Chances are very good that either you or someone you know suffers from migraines. And so we're bringing in what I feel is Mansfield's foremost expert in the area of migraines, and that is Dr. Joseph Adams. He is here today. He's from Calibration, Chiropractic, and Functional Health. Dr. Joe, how you doing today?
Doing good. What about you, buddy?
Trying to stay warm, actually.
Yeah, yeah.
We got up this morning, 39 degrees driving in, but I understand overnight it's supposed to be in the 20s into tomorrow. So pipes, pets, and people, the three Ps.
Three Ps. That's awesome, man. I'm
Right.
gonna remember that.
Yeah, do you not know about that? All
That's
us news people know, pets, plants, and people. Take care of them and get them indoors. So, but we're
no,
not
that's
here to
awesome.
talk about the weather and specifically about migraines. We've touched on this a little bit in the past, and I want to kind of revisit this and get a little more specific about nutrition because we did talk about how processed foods and red wines and things like that. Let's talk about things that people don't know about migraines and nutrition.
That's a good one. I think there's a lot of information on this topic, and so it's good to circle back to it, considering that diet is the most complicated factor to manage in a migraine patient. And a lot of people realize, like you said, that there are certain foods that are notorious, if you will, or infamous, if you will, that are not good for them, and they can trigger migraines. But what a lot of people don't realize is there's also some other like finer points. And so I want to go over some of those finer points. And I think the first one we should definitely cover is blood sugar regulation. So when I say that, I mean you need to keep your blood sugar, maintained at a nice even keel all day. So we don't want to see like spikes in the blood sugar. And one of these ways you can measure if you're doing that to yourself, we can all do it whether you have migraines or not, is if you eat a meal, let's say a large meal, and let's say 30 minutes after eating that very large meal, you may feel tired. Have you ever had that happen to you, Steve?
Oh yeah, yeah, especially with pizza or pasta.
Boom, there it is. Yeah, that's exactly what you just did. So you spiked your blood sugar so high that your body then came right back down. So your blood sugar is basically going up and then coming right back down. And so you get that spike of energy, and then you have that tired feeling, that sluggish feeling, about 30 minutes afterwards. That means you ate too much, you overate. And that can happen not only in a meal, but it can happen through the day, like at every meal, right? If you were to do that to yourself every meal, that's 3 times a day. And then if you are not getting enough food throughout the day, or the right amounts of food, then you're going to have these spikes all day long, and that can trigger a migraine. And that's one of the things that I think is less known about the diet component.
What is one of or what are the ways or a way to regulate your blood sugar?
Yep. So the best way to do this is to try to eat frequently. So if you're a migrainer, you need to eat frequently. Every 2 to 3 hours is going to be the best bet. And it's going to be really important to regulate the amount of carbs that you take in too. And I say that because they've shown that eating a slice of bread will spike your blood sugar more than eating like a Snickers. So it's really important to limit carbohydrates, because if you're eating a good amount of carbohydrates in some of these meals or some of these snacks, your blood sugar spikes are going to be pretty high, and that's going to set you up for failure. So we got to limit carbs too.
And I was just going to ask about that. So every 2 3 hours, a candy bar is okay.
No, I
Yeah,
wouldn't go for a candy bar. Yeah, yeah, yeah. You picked up on that. So yeah, candy bar is probably not the best option. Protein bar, I like that. Yeah, and they make some protein bars these days that taste just as good, if not better, than some
Oh
candy
yeah,
bars.
yeah.
So I think that a protein bar would be a good option, or like nuts, like getting a handful of almonds, cashews, no peanuts because they're legumes, not nuts, right?
Right.
So So yeah, we don't want that. But we're trying to basically limit the carbohydrates and increase your protein and fats during these snacks.
Pecans. I love
Yeah,
pecans.
yeah, yeah. You can do that for sure.
Okay.
Yeah,
Actually,
or
I love pecans on pecan pie.
yeah, no,
No?
no. You're killing me. You're killing me.
So, all right.
But the,
It's
yeah.
that's right. This is a very serious topic, but
Well, no, it's actually really
it's
funny that you say that because this is why it's so hard to manage migraines with nutrition because it's hard to have the self control to not have the pecan pie. It's hard to have the self control to not eat like the cookie as your snack. Especially if you're a female, in the busiest part of her life, which usually that's the person who suffers with this, who's got kids, right? I mean, like you're a lot of days you're probably just struggling, man. And you just need a cookie, right? But you can't have the cookie.
oh, but I love Oreos.
Yeah, yeah, yeah,
Double stuffed. Now, so what I'm gathering that and regulating your blood sugar is almost the same thing as regulating with diabetes. Is it?
yeah. I mean, that's kind of a way to think of it. Yeah, I mean, that's a good way to kind of for people to think about it, right? So you're just trying to regulate your blood sugar and not have it, spike too high or too low, because this is going on all the time for all of us, 24/7. There's this blood sugar, cascade in the background in our physiology, and it needs to be managed well, just like you would manage it for diabetes. It's a very good correlation.
All right. Great. It just came to mind. So, all right, let's recap. We've talked in the past the processed meats, pepperoni,
Yep.
salami, capicola, all the Italian meats. Not real good for you if you suffer from migraines. Caffeine, red wine. How am I doing here?
Yeah,
This
the tannins in it. Yeah, you're doing good. Yeah.
okay. And then, as we've covered today, regulating your blood sugar, eating small amounts of food, but about every 2-3 hours. Oh,
Yep.
okay. Question then. You sleep for 8 hours. What happens to your blood sugar while you've gone into sleeping and you wake up the next morning? So you
Yeah,
mentioned
so that's
talking
a
about
that's a really good question. So
right. You mentioned about eating every couple of hours, but you go 8 hours while you're sleeping.
yeah, so this can be a tricky one for people, and so I think there are people who deal with waking up with migraines, and that could be possibly because their blood sugar is not regulated, and so a lot of what you need to do to help improve the nighttime blood sugar regulation, really a lot of that's done during the day, right?
Mm.
Because if you eat a healthy meal before bed, like let's say dinner, like that doesn't have too many carbohydrates in it, not having a lot of pecan pie, if you were to do that, and then let's say right before you go to bed, have a a healthy snack, like protein fat type snack, um, that digests much slower than a carbohydrate, and so that will help you carry your blood sugar through the night, because obviously your blood sugar does drop if you've been fasting for 8 hours. And so you really need to let yours kind of taper into that mode instead of go like this and then go to sleep and then just do this the whole time, right? And you wake up with a migraine.
If anybody has any questions about regulating their blood sugar, if they have questions about migraines, if they have questions about Dr. Joseph Adams, how can they get a hold of you?
Yeah, we're pretty easy to find. We're at calibrationchiropractic.com. We are on Facebook, Google, YouTube. You can find us anywhere. So we'd be happy to sit down and just have a conversation with anybody who's suffering out there.
And I know that you're in downtown Mansfield. I do want to throw this out there that it is Arts Week this weekend in downtown Mansfield. So if you're downtown at the Far Best Theater or doing something related to Arts Week, Dr. Joseph Adams is right up the street there
Yep.
at South Main and Hunt. Is that right?
Yep. Yep.
There you go. Dr. Joe, we'll see you next Friday where we'll get pickled next week, right?
Yeah. Yeah. Yeah.
Good to have you on. We'll see you next week.
All right, let's see, buddy. Take care.